5 years ago, when I was giving a health talk in front of my clinic to a group of elderly women. After the talk ended, one of the ibu approached me with a supplement in her hand. She approached me and she said, "Dok, boleh nggak saya minum ini? Can I take this supplement, Doc? Is it safe for me?" My WhatsApp group said it could cure my back pain, my knee pain, and even cure my wallet. But at that moment, I realized an important fact, a fact that I could not ignore anymore, such as yourselves here. The fact is, my competitor wasn't my specialist doctors, it wasn't my fellow doctors, nor is it the hospitals. My competition is WhatsApp University. WhatsApp or social media has taken over the decision that Ibu Tuti made. Imagine this. Before you came into this auditorium, and imagine the process thought behind Bu Tuti buying that bottle of supplement. She was probably shown thousands, if not hundreds, of messages and ads on her Facebook, on her WhatsApp group, and whispers from her neighbors and her friends. And at the end, she bought that supplement and asked that question to me. Nowadays, more people are getting health advice from TikTok than from their own doctors. And this is a fact. Now raise your right hand if you've ever searched your symptoms in Google or ChatGPT. 1, 2, 3, yes. Almost every one of you do it, including myself. Yes, that is also a fact. TikTok and social media is so powerful that we can't ignore it any longer. These videos you see on the screen are evidence and proof that everything we search now are on social media. But not all social media information are valid and true. Some of it are messy. Drink this juice, it can cure cancer. Take this supplement, it will fix your back pain. But nobody, including the application themselves, are verifying the information that are being put online. But these videos are entertaining. They're fun. They're easily shareable to your friends and to your WhatsApp group. Some might call us crazy, but is this the future? We shall see. On the right is a video of a simple message. Sepele, tapi bisa merenggut nyawa. The moment that hit your brain, it also triggers an alarm. Because we as humans, the number one emotion that drives us are fear. That's why 90% of what you are seeing on your social media is fear. That's why this video gains over 500,000 views in 24 hours. It's shareable. It's easily forwarded. It triggers you to comment. But the truth, like on the left, a 30-page journal about the importance of vitamin D, it's boring. It's boring. It's hard to understand with medical terms you've never probably even heard in your entire life. That's why social media is powerful. Everyone remembers their first love, their first paycheck, their first job. Nobody forgets their first, including mine. 5 years ago, after Bu Tuti asked me that question about that supplement, I went home I sat down thinking there to myself, and I took my phone, I put on my doctor's coat, I put it across the table, and I pressed play. At first, I didn't know what I was talking about. I didn't even know how to record a video properly. But there is one thing I know, and I hold dearly till the day today, and it is not a coincidence I'm standing in this red circle talking to everyone in front of you, that I want to provide value. Because at the end of the day, it's what matters most for you, not for me. And that is the principle of a doctor. Do no harm. Provide value like it was given for my own family. Then, as time goes by, I continued. I continued giving videos, giving value, talking about supplements, women's health, and debunking health myths one video at a time. And 3 years later, I found my first health and wellness creator from TikTok and gained over 4 million followers that I've helped to build a healthier and conscious mind. To put that into perspective, these numbers aren't for gloating. It isn't for boasting to you, oh, look how many followers I have. No. To put into perspective, now imagine this, really imagine this. 1 week of creating every single day, just one video, just a single video about medical and health tips, I can reach more people than 1 whole year in the clinic. Imagine that. Only one video a day can reach more people than 1 year I'm sitting in a clinic. Now that's real power. But at the end of the day, you want to know, why does social media works? Why does everyone keep checking their phones every 30 seconds to a minute? Let's know why. Social media speaks human. It doesn't speak medical. What does that mean? Let me give you an example. Let's say you are lately feeling dizzy, tired, and probably a little pale. And then you went to the doctor, and then you said, oh, doctor, I'm feeling a bit dizzy, I'm a bit weak. Oh, yes, then the doctor said, you must check your blood. Okay. Lab results came back, and then your doctor said, oh, yes, you have microcytic anemia. What the hell does that mean? You've never even heard the term in your entire life. Moreover, relate to it. It's impossible. But when you see a video on your phone screen, your 30-second Instagram reels that said, oh, I'm experiencing the same thing. Kamu capek-capek, cepet lelah, jangan-jangan kamu kurang zat besi. It hits your brain instantly. I have a friend on the other side, even though it's from a screen, that is experiencing the exact same thing. Now that is relatability. Now that is human talking to another human. You're not talking to a machine. And that's why social media is powerful. It speaks human, not medical. Moreover, when you scroll past again and you find another video, that's connection. I connect with someone like I'm connecting with you now. And connection means trust. And when trust is made, you get attention. And that is why we're almost 10 minutes into this talk and nobody has picked up their phone, not even once. That is real power. Because in this day, today, in this very room and this world, attention is the most powerful commodity. When you own attention, you build connection. And that is why social media is powerful. Because connection trumps advice every day of the week. Every day. If you tell someone, don't do this, don't do that, they will not hear you. But if you do it with them, you show them how it's done, that's connection. That's why a good parent also shows how it is done, not just tell you how it's done. That's the most important thing. Social media now has become the new waiting room. If you've ever been to a doctor, you've probably waited, 10 minutes to 30 minutes to see a doctor, maybe even more. Now you're waiting at home while you're sleeping under your bed, looking at your phone. Now that is the new waiting room. Social media has gathered so much information for you to digest, to absorb, and it's done so quickly that you wouldn't realize you're doing so fast. On average, a person, every single one of you, will scroll on TikTok or Instagram in an hour, 1 hour, you will scroll about 100 videos. 100 videos, either to 30 seconds to 60 seconds, 100 videos. That's the average Indonesian scrolling rate. Now tell me that isn't the new waiting room. The challenge is, social media can educate millions. And what I aim it to be is to improve that good and positivity can spread more than the negativity in social media. It's hard, maybe even impossible. But 5 years ago, I didn't think I was going to be standing in this red circle. But yet again, nothing is impossible. But the challenge is, there are so many hurdles we need to step over in order for this to happen. The challenge of not scrolling every 100 videos in an hour, verifying who is delivering the information, and what is the information about. Because the algorithm doesn't care about accuracy. It doesn't verify who is saying this information, but the algorithm cares about likes, about comments, about shares. That's what they prioritize. That's why, sadly, in Indonesia, the top 10 viral videos are drama about artists, divorce, and gossip. But we can change that one video at a time. That's where I come in. Doctors and medical professions need to upgrade not only their knowledge, but their presence on social media, not to gain followers, but to better serve you, to provide better information, reliable information, and credible information that you relate. And when somebody says healthcare is the future of social media, it's already here. It's already here, happening in this very room, in the palm of your hands that you're scrolling right now. And when you can't control it, it either becomes your disease or your medication. And the fun fact is, 86% of Indonesians are already online, having access to high-speed 5G internet. The rest of 14% are probably living under a rock or have bad signal. So basically everyone owns and has access to the internet. So my last question to you is, what's in your feed? My name is Dr. Kevin Mak. Thank you for your time.